Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today I'd like to do a brief episode on body acne, otherwise known to some people as Bacne. But body acne can go to the chest, the back, the shoulders, the upper arms. Some people get it on their neck, although I would sort of consider the neck an extension of facial acne. But some people get body acne only, and then other people get both the face and the back. And sometimes I have people on programs that are the same for both areas, and sometimes I have people on programs that are different for both areas. It really depends on the patient, their lifestyle, the type of acne that they have. So today I'd just like to focus on body acne. And I'm going to make a set of specific recommendations, and they're numbered 1 through 9. And these apply to adults and teenagers. And a lot of these recommendations can be done with over-the-counter things and lifestyle changes. So let's get started. Number 1, if you are sweaty, get the sweat off fast. So the easiest way to do that is to shower quickly after the gym, or if you're hot and sweaty, jump in the shower. But if you do not have access to a shower, then you can try to get the sweat off with a baby wipe or a hand wipe, or you can try to get the sweat off with just damp paper towels in a bathroom, or you can just at least try to change your clothes to dry clothes. So, if you're caught off guard and you're a little sweaty, then just try to figure out what's the best way to get the sweat off, because sitting in sweat and sitting in sweaty clothes is not good for body acne. So do your best on that. Number 2, when you're showering, I prefer a benzoyl peroxide wash, usually a 5 or 10%. This is available over the counter. I recommend doing it last before you get out of the shower. So after your hair routine and everything else, basically if you have long hair, clip it up and then take some benzoyl peroxide wash on your fingertips and apply it to the affected areas and let it sit on for anywhere between 10 and 30 seconds. Then just rinse it off. When you get out of the shower, if you haven't gotten all the benzoyl peroxide off, it will bleach your towel, so just be careful or use a white towel. If you cannot tolerate benzoyl peroxide or you're allergic to it, I do recommend trying a different over-the-counter antibacterial wash. Dial soap is often recommended. It should say antibacterial on it. It has a different ingredient than benzoyl peroxide. It's not quite as good for acne, but it would be a good second-line agent. Another alternative would be to use a salicylic acid wash. Those usually come in 1 or 2%. Those are exfoliating. Again, if you're allergic to benzoyl peroxide or don't tolerate it well, salicylic acid is a good alternative, but it is not antibacterial. Some people like to rotate these things. My favorite is the benzoyl peroxide. I also like to mention no scrubbing. So I don't like body washes that have beads in them or scrubs in them or any kind of washcloth or buff puff. Just fingertips and a gentle benzoyl peroxide cleanser is ideal. Number 3, if you can get prescription clindamycin, that is my favorite topical for body acne. Clindamycin comes in a solution, in a gel, in a foam, in a lotion. It comes in little pads. They're like little alcohol wipes that have clindamycin in them that are really good for on the go. For this, obviously, you need a prescription. It's nice because it doesn't stain your clothes. I usually recommend trying to use it at least once a day or twice a day to the affected areas, and that can be extremely useful. Number 4, in addition to clindamycin, or if you cannot get clindamycin, you can use an over-the-counter benzoyl peroxide gel or a prescription combination product to the affected areas. So some people will use a plain clindamycin in the morning and at night do a combination product of clindamycin and benzoyl peroxide. Sometimes if insurance does not cover that, I will have patients make it themselves by putting on the plain clindamycin and then applying an over-the-counter benzoyl peroxide 5 or 10% gel on top. reminding people that benzoyl peroxide bleaches things, so it bleaches your nightshirt, your pillowcase, your fabrics, your sheets, etc. So I don't recommend doing this during the day. I would only do this at night. Number 5. If you're not in the sun that much and this works for you, you can try to use a retinoid in the morning underneath your clothes, such as over-the-counter Differin or prescription Retin-A. Retinol would also help here, but it's not quite as strong. This is very helpful for exfoliating and unclogging pores, but retinoids do make you sun sensitive. So they're easiest to use on the body underneath clothes during the day because they shouldn't stain your clothes and it shouldn't be a problem. But just to remind people that even if you're using them underneath your clothes, they will still make you sun sensitive. When you use retinoids, the sun sensitivity can last for up to a week or so afterwards. So just a reminder, if your body is going to be in the sun, to use your sunblock, which we should be all doing anyway. Also to seek shade. If you know you're going on a sunny vacation, sometimes I tell people to stop their retinoids a full week before they go. That still means they need to use their sunblock and seek shade, but it removes that extra sun sensitivity. Number 6, if you have trouble reaching the areas, you can buy a back applicator, not a back scratcher, a back applicator. These are sold at surgical supply stores, or I'm sure you can buy them online. They're not the easiest thing to use, but it is preferable to not putting anything on at all if you have areas that you have trouble reaching. I find a lot of people, if they use both their arms and they go above the shoulder and then twist and do the other way, can really reach almost their entire backs, but some people can't, so a back applicator would be useful. Number 7, if the patient is not doing well with just topical therapy, then they can go on oral medication, such as antibiotics, Accutane or isotretinoin. For women, birth control pills or spironolactone. I went over these in other podcasts, and if these are something that you need to learn more about, please go to those podcasts for more information. Number 8, if the patient cannot tolerate pills, photodynamic therapy is very useful for body acne. The trouble is it will be a bit cumbersome and very expensive, but it does work well. Photodynamic therapy, I also went over in the podcast about acne. It's FDA approved really for skin cancers, but it's used off-label for acne. And you could try to find yourself a dermatologist who does photodynamic therapy for acne. Number 9, I also often do repeated chemical peels on the body for people who are suffering from acne. It exfoliates, it helps fade the marks that the acne is leaving, and chemical peels are a good adjunctive treatment. They can also be a primary treatment, and they work incredibly well, but it does require a lot of them. So that's the numbers 1 through 9 in terms of my advice for body acne. And I would say in summary, get the sweat off, use a medicated wash, do not scrub, try to get yourself benzoyl peroxide, salicylic acid, or a different antibiotic soap to wash with. Over-the-counter Differin or Retin-A can be used in the morning. Clindamycin, benzoyl peroxide, can be used at night. There are pills of many types that can help this, or photodynamic therapy or chemical peels. If you or a family member or friend are suffering with body acne, get yourself to a dermatologist for help. It is a very treatable condition. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.